Okay, so welcome everyone to the Root Cause Reset preview call, Unraveling Disease with Functional Nutrition. I'm your host, Angie King-Nocer, and I am a functional medicine nutritionist and transformative coach with EnlightenedWellnessFX.com. Enlightened Wellness is my 100% virtual functional nutrition healing practice. I see people from all over the country and help them to virtually figure out what's going on in their body and why their body's acting out. And we break it down, we work through it, unravel it through the functional nutrition approach. A little bit about me and my background. I am a registered dietitian nutritionist. I have a master's degree in nutrition from University of New Mexico, and I'm also trained in functional medicine. I've actually trained in both functional nutrition and functional medicine through the Institute for Functional Medicine. And I'll tell you a little bit about what functional medicine is in a moment. I was a clinical nutritionist for the UNM, or University of New Mexico's pediatric nephrology program. My first job out of school from 2007 to 2011. And so I got a good sense of what goes on in conventional practice. And as I started learning about functional medicine and functional nutrition, that just primed me to really see what goes on in conventional practice and kind of made me uncomfortable, in that setting, because I was learning a different approach to disease and to treating disease with diet and lifestyle and nutrition. And so eventually, my training in functional medicine prompted me to exit the conventional setting to where I could really blossom as a functional practitioner. I'm also certified in the transformational coaching method, and that the skill set that I have from that certification really helps me in eliciting behavior change, with my clients, both individual and group clients. Because really, when we're looking at, functional medicine, functional nutrition is so grounded in diet and lifestyle change, and that's all behavior change. So I thought it was pretty imperative that I get, extra training in eliciting behavior change for people. I'm also a Hashimoto's Institute certified practitioner through the Hashimoto's Institute. So I have a really good working knowledge of how to use functional nutrition to address thyroid issues, and in particular, Hashimoto's thyroiditis, which is an autoimmune form of hypothyroidism, which actually accounts for up to 97% of hypothyroidism cases. It's severely underdiagnosed. So I actually, I really enjoy helping people to differentiate and understand through investigation, is your hypothyroidism just plain old hypothyroidism, which is still, involves nutrient deficiencies, or is it Hashimoto's? And then what do we do to treat that? And my specialties are autoimmunity, digestive dysfunction, and Hashimoto's. My mentors, in addition to the trainings, that I do continually, my most prominent mentors, I would have to say, are Tom Maltaire, Andrea Nakayama, Summer Bach, Dr. Alan Christensen, and Dr. Isabella Wentz, PharmD. If you looked into functional medicine and functional nutrition, these people would likely stand out to you because they are leaders in the field. Oops. And about me as the person, I am a mom. I have a 16-year-old daughter, Ryan, and a 3-year-old son, Issa, and an amazing husband, Gabe, who I've been married to for 6 years and been with for 10. And I just want to also take this time to, yes, I have an in-depth background. I am a functional medicine, functional nutrition practitioner. I do help people, with their health transformations, but I don't ever want anyone to lose sight of the fact that I'm a real person with real struggles, and I have a journey I'm on my journey. It continues, my own healing journey, that informs, who I am as a practitioner, and shaped who I am, also as a person. And I just want to give you a couple of snippets of my journey, so that you understand a little bit more about where I come from, on a personal level. As a kid, I was very overweight, and so, and I was raised by my grandparents who were brought up in the Great Depression, and were brought up with a lot of food insecurity. And so when they finally did have the means to have food on the table, every meal, they really, found pleasure in feeding people, particularly me. So they comforted me and consoled me with food a lot, my parents not being around consistently. And so as a result, I was very overweight as a kid. And, but on the flip side, they were very supportive when it came time, when I reached, just the summer or the year before I entered high school, I decided I was going to, have a different, high school experience than, middle school and elementary. So they were very supportive of me. And my journey with weight, has continued. It has fluctuated throughout my life. But when I finally figured it out, I figured out that it was all about blood sugar regulation for me. And what I've seen is that it's all about blood sugar regulation for most people. Not only for weight management, but for mood and energy levels as well, and inflammation. And we are going to get into that in a little bit, and very in depth into that in root cause reset. So, I've had that, I guess, struggle, but it's, been a very informative struggle. And it's really, like I said, shaped who I am as a person as well as a practitioner. And then another snippet of my journey is that in 2011, my last year at UNM, I went in for a routine TB test, that every clinician has to get. And they send you this jolting letter. You have to come in and get this test done by this date, or you can't come back to work. So I went in, got this test, and if you haven't had a TB skin test, it's deadened TB bacterium in a preservative solution, very similar to a vaccine. And they just insert, they inject that solution under your skin. It kind of bubbles up on your forearm. And you wait and see, if you have a big, inflammatory rash reaction, then, you have to go through treatment for TB. Well, mine came out negative, but that test site just stayed red, and it never went away. And a few weeks later, it got sunken in, and it looked like ringworm, and it was itchy. And then gradually I started getting these lesions of varying sizes all over my body. And I was just in a tailspin. I had no idea what was going on. I started Googling, and that was a disaster. And, I waited a couple months to go in, because in my clinical job, I worked with, a lot of kids who had autoimmune issues, and saw the devastating effects of the drugs that were given to them, particularly steroids. And so I said, I know this is autoimmune, but I'm not willing to take steroids. That's not going to be me. But I finally went in and got a diagnosis, and it was an autoimmune skin disease called granuloma annulare, and which is only typically found in people with cancer or AIDS. And but what I found out was that it's associated with TB skin tests. And I was really upset, because no one told me that. I had no idea that I was putting myself at such risk. And autoimmunity, happens for a few reasons that we'll get into later. But, and granuloma annulare doesn't happen to everyone who gets a TB skin test. But I just happened to be, that person who had the right setup for it. And I was really disillusioned at that point, with conventional care, and the lack of true informed consent. So that has really, and that's really informed and shaped my journey, as a practitioner, and makes me who I am today as a practitioner. But, you know, so I declined the steroids and decided to wait it out, even though it would have, you know, been a quick fix to a very embarrassing, uncomfortable issue, because I didn't want to, because I wanted to avoid the short and long-term effects of that, of the drug, of the prednisone that she was offering me. So I decided to wait it out and also continue looking into, because I was already had started, you know, learning about functional medicine and functional nutrition. And through gut healing strategies and, you know, avoiding foods that I have become aware of, you know, that are triggering for me, that trigger inflammation for me, you know, I haven't had a lesion in over 3 years. So, and I'm going to talk about, you know, the functional nutrition process that I put myself through and that I take clients through, and how that can help you if you're struggling with inflammatory symptoms and or autoimmune disease. And we're going to be going through that process in the root cause reset. So today's objectives are, you know, I'm going to describe the function, what functional medicine is, because I've been talking about it, but maybe you don't know what it is, and the functional nutrition approach. I'm going to define those for you. I'm also going to discuss common core imbalances through the H.I.D.E.N acronym, and their root causes through the S.T.A.I.N acronym, and how to address these in a personalized way to unravel disease for you. We're also going to discuss the top 3 inflammatory foods that we are going to take out initially in root cause reset, and I'm going to lay out, you know, the details of root cause reset for you. So to start, functional medicine, if you haven't heard, is an evidence-based field of medicine that's grounded in biochemical individuality. So no two people are alike and no two treatment plans are alike. There may be similarities, but everything is tweaked to the individual. It's grounded in patient-centered care, so it's not the paternalistic doctor-patient, practitioner-patient relationship, you know, where the practitioner really runs the rules the roost and gives the orders, and the patient follows, you know, is expected to follow blindly, and, you know, without much question or guidance. It's really about engaging in a therapeutic relationship between practitioner and patient or client. And, you know, we observe, or we understand that there's a dynamic balance of internal and external factors, you know, that contribute to a person's clinical presentation. So, you know, that we have to work to restore that balance, to reverse disease. We, you know, understand that there are web-like interconnections of physiological factors. So it's not just, you know, looking at one organ. It's really understanding how all the organs and systems work together and maybe impacting one another as well. You know, in the conventional model, we have specialties, and I worked in that model, and I was, you know, in a subspecialty. So I know from experience that, you know, specialists really deal in their organ, and if there's, you know, and there's really not a whole lot of consideration as far as how other organs are playing a role and how other systems might be playing a role. We view health as a positive vitality, not just the mere absence of disease. So we really want to get a person into, you know, their optimal state of health, not just treating them when there's a full-blown issue. And then looking at, you know, the promotion of organ reserve, not just waiting till that organ is failing to do something for it. And we look at, one of the ways we can look at organ reserve and system reserve is really to view lab ranges through a functional lens and interpret them so that we're looking for optimal, not just normal, and, you know, maybe on the verge of disease and breakdown. So functional medicine also involves examining those core imbalances that underlie a disease or condition, and we're going to talk about those shortly. and looking beyond signs and symptoms to a deep understanding of functionality. What's causing those signs and symptoms? What systems need support? Instead of just masking the symptoms and, blocking certain pathways and sort of forcing the body into submission. And we understand that these imbalances arise as environmental inputs filtered and processed through a person's unique metabolism. So these environmental inputs are going to be diet and nutrients, including water, exercise, trauma, and really everything about a person is affected by their mind, spirit, attitudes, and beliefs. So it's really about treating the whole person and not even just looking at what's going on now, but looking deep into their history to figure out what factors, started this process and set this person up for their current condition. Functional nutrition is clinical nutrition from a functional medicine perspective. And functional nutritionists are adept at identifying core imbalances that most often result from a system breakdown or system breakdowns at any point. And we know that most core imbalances are, if not all, are diet, lifestyle, and mindset related and can be prevented and treated with modifications to these or shifts in these areas. And in functional nutrition, we assume that food contains molecules that are necessary, purposeful, and designed to support life, promote well-being, and optimal health. And that may sound like a no-brainer, but I can assure you that in regular conventional practice, this is all too often taken for granted and undervalued. Instead, the first-line therapy, is medication and surgical intervention typically. And of course, it's also about understanding the roles that these molecules play in human beings, and then adapting the applications of those molecules to meet the unique genetic and environmental needs of a person or patient. When I came out of school and as a conventionally trained nutritionist, and I'm sure, I know it's the same way for physicians, we have a lot of knowledge, and there are all these metabolic pathways that we have memorized, and we know, every step we can recite, and what nutrients come into play at each step. But what I recognized for myself is that at that point I had no real working knowledge of how to apply this to a patient or a person in front of me with a disease state. How to use my knowledge and of these pathways and of these nutrients to really shift this person's state. So yeah, it's not as much about memorization, it's more about having a working knowledge. And I didn't really see any opportunity to develop that until I got into functional medicine and functional nutrition. So let's talk about the core imbalances. Hormones. So the H.I.D.E.N is the acronym that we're following. So first of all, hormones. Our symptoms can tell us what core imbalances we're experiencing. So if we have an imbalance in our hormones, we might see symptoms like severe PMS, painful periods, infertility, adrenal dysfunction or adrenal fatigue is it's popularly known, blood sugar imbalances, which eventually can lead to diabetes, polycystic ovary syndrome, excess abdominal fat. These are all signs of hormone imbalance. Immune system. So the things that we might see with immune system imbalance would be inflammation, and we'll talk more about inflammation, because really inflammation is going to be behind any sign, symptom, or disease state. But also allergies, autoimmunity, low vitamin D, and even weight loss resistance. I've had clients who have struggled relentlessly, with weight and losing weight, and are just, continually told, eat less, exercise more. They try diligently, and nothing works. And finally, we figure out that, it's the inflammation, and maybe they have an infection that's also driving inflammation. And once we clear that, the weight just comes off. And it's so amazing to see and to finally be able to give someone what they've been after for so long, to no avail. So digestion, we can have an imbalance in digestion, might look like heartburn, reflux, anemia, eczema, nutrient deficiencies, especially B vitamins and minerals, bloating, IBS, frequent infections, detoxification. In functional medicine and nutrition, we always think about detoxification, how well a person is able to clear compounds from the body. And symptoms of poor detoxification might be fatigue, food, drug, and chemical sensitivities, shortness of breath, water retention, puffy eyes. These are just some of the things that would give us clues to, poor detoxification. Environmental, so nutrient insufficiencies, drug side effects, mold and chemical exposure, reactivity, again, weight loss resistance, because there certainly is a component of, environmental exposure and input. And then neurotransmitter function. So we might see, anxiety, depression, irritability, as examples. And I want to just, talk a little bit more about inflammation. Inflammation starts in the gut, plain and simple. And that's because 80% of your immune tissue is housed in your gut. And it has to be that way because the gut lining, or the gut, is the barrier between your outside environment and what's coming in and your bloodstream, So, so your immune tissue is right there waiting to intercept anything harmful that could be coming in through that route. And things that can cause, inflammation in the gut and lead to that, number one is impaired digestion. When we're not digesting our foods properly, perhaps because we're eating in a state of fight or flight. Our nervous system is we're in fight or flight mode or rest and digest mode. We should be in rest and digest mode when we're eating, but a lot of times we're in fight or flight mode. We're thinking about our deadlines and the things that we have to do, and what so-and-so said, or what our boss is going to think. And so we're a lot of times in fight or flight mode when we eat, and we're not making proper digestive secretions, and we might not even be chewing our food properly. Most of the time, that's the case for people. And, it's something that I even have to be mindful of, all the time. I have to check myself on that. So when we have undigested foods, especially undigested proteins, these undigested proteins, then they make it to the small intestine. We're going to see those activate the immune system, and we're going to develop sensitivities to that food, and also start the process of systemic inflammation. So impaired digestion is a major root cause of that inflammation in the gut and systemically. Gut microbe imbalances lead to not only impaired digestion, but inflammation in the immune system. Even just a small shift in the ratio between our friendly bacteria and our potentially pathogenic bacteria sets off an inflammatory response in the gut, and then therefore systemically. Gut infections, in particular, something like H. pylori, which interestingly I find is underdiagnosed. I have people come to me who've been to a string of GI doctors and have, major digestive issues, and have never been tested for this or other gut pathogens that, could be at play. And these gut infections are going to cause, perpetuate inflammation in the gut and systemically. And then there's increased intestinal permeability, or leaky gut. I'm sure by now, I think most of us have probably heard of leaky gut. And we're going to talk about that more in a moment. And I have a nice diagram for you to show you what that looks like. But a leaky gut, it really, it's those intestinal cells are what connects them in between are called the tight junctions that are supposed to only allow a certain size molecules through, like individual amino acids that, you know, are the building blocks of protein, and individual sugars and other, you know, very small components or compounds. But when these tight junctions are open and when that gut is leaky, then we can start letting other, you know, undigested proteins through that then interact with our immune system, and even bacteria and their wastes as well, which causes inflammation and stress in the body. So, you know, that's really, you know, a quick overview of how inflammation starts in the gut. And of course, you know, how inflammation then is perpetuated systemically. All starts in the gut. So the root causes of our core imbalances can be summarized through this acronym, S.T.A.I.N. So stress, both emotional and physiological. Toxicants, both exogenous, made, you know, outside the body, like man-made chemicals, you know, those that we're inundated with these days, as well as endogenous toxicants, those that are made within the body. So if you've got a gut infection, for instance, or overgrowth of certain microbes in the gut, they're making waste products, and these are, you know, internally made toxicants that can make their way into your bloodstream, especially if you have a leaky gut. Antigens and allergens, these can come from both food and, you know, the environment. Infections are a big root cause of core imbalances and inflammation, and these can be acute. You know, they might be very obvious, something that you you know, would have a fever and you know, feel really poorly, or they could be underlying or stealth, and not be obvious at all, but could still be driving inflammation for you. One moment. And these can also, you know, these can affect the gut as well as, you know, other organs, and affect a person systemically. And then nutrient deficiencies are going to be underlying, you know, can cause core imbalances, because all aspects of metabolism run on nutrients, period. So, oh yeah, and when we, you know, the functional nutrition approach, before I get into the elimination diet, I just want to say that where we really want to start is by managing stress. So emotional stress, we want to work on mindset shifts, slowing down, being more mindful, not only in our lives and how we respond, you know, to stressors, because it is a choice. We just have to know that it's a choice, and be aware in the moment that we have that choice, and as well as physiological stressors, and that can include, it kind of overlaps with antigens and allergens. So we want to take foods out that are most commonly or that are common culprits in driving inflammation, and that we're most likely to be responding to. And let's see. Yeah, so we want to take those foods out, and a lot of times, you know, you can go find many books on elimination diets and look something up online, and you can take foods out. And I've had people come to me where, you know, they say, I did this elimination diet, I did GAPS, I did low FODMAPs, I did, you know, all of these, and I still don't feel, still not feeling better, like something's still off. Well, the other thing that you cannot skip really is addressing stress. And slowing down and optimizing, and in doing so, optimizing digestion, and also optimizing blood sugar, because dysregulated blood sugar is a form of physiological stress as well. So we will start with stress and self-care in the root cause reset, and we'll also start by taking out the top 3 inflammatory foods. And switching you into you know, a whole foods diet, getting rid of the processed foods and really getting into whole real foods, while taking out these top 3 inflammatory foods. So let me talk a little bit about those so you understand why. Why would we take these out? Why are we focusing on these? Why are we putting ourselves through this, right? So sugar, public enemy number 1. refined sugar, that is. So just a little background on sugars. You know, they're the building blocks of carbohydrates, and your body breaks down carbohydrates, you know, and releases sugars into your bloodstream after you've had a meal. Well, if you're taking in complex carbohydrates, carbohydrates that, if you think about a tree, you know, would have a lot of branches, they have a lot of fiber, and it's harder, they're harder to break down, they take longer to break down. So there's this time release of sugar into your bloodstream, as opposed to a refined carbohydrate like white bread or pastas, or you know, even whole grain breads. You know, anytime you pulverize a grain and make it into a flour, you know, you're taking a lot of the work out the body has to do. So in a sense, even whole grain flours are refined, and they have a quick impact on your blood sugar, you know, a quick hit of sugar into your bloodstream, rather than that time release effect from eating that you get from eating complex carbohydrates like fruits, legumes, vegetables, and whole unrefined grains and seed grains. So sweet tooth symptoms, you know, if you have swinging blood sugar, so you have those spikes and crashes, you know, when you spike your blood sugar by eating, you know, refined carbohydrates and refined sugars, then your body is going to respond by, you know, producing a surge of insulin, almost always an overcorrection that drops your blood sugar dramatically. So you have these swings in blood sugar, and the symptoms of that will include shakiness, rapid heart rate, sweating, dizziness, anxiety, hunger, intense cravings, especially for carbohydrates and sugars, because you want to get your blood sugar back up since it's dipped. Blurry vision, weakness and fatigue. You know, that afternoon dip usually has to do with a blood sugar crash. Headaches, irritability, and of course, you know, mood swings. I have a client who, you know, we've been working together for a little while, and she kind of lost sight of the whole blood sugar regulation thing. You know, had sort of strayed off a little bit, you know, as people do, everyone does. You know, the line from A to B is never a straight one. So, and she was having a lot of anxiety and bouts of depression and self-loathing, and just really off with her eating. And we looked at her journal, her what I call the food mood poop journal. I'll show you in a little while. And it was clear that she was not eating in a way that supported a steady blood sugar, you know, steady rises and dips, not spikes and crashes in her blood sugar throughout the day. And that really was what was going on with her. And once she got back on track with regulating her blood sugar, her mood swings disappeared, and, you know, life was great again. And she was finding it much easier to eat well too and make good choices. So here's just a little depiction of high glycemic, or excuse me, of the glycemic load. So glycemic literally means causing sugar in the blood. So certain foods are going to, you know, have more fiber and have a lower glycemic impact, meaning it's going to take much longer. There's going to be that time release of sugars into the bloodstream. Whereas high glycemic load foods, like these ones on the left, in the red, they're gonna impact your blood sugar very quickly and cause swings. So if you choose foods that are in the low glycemic load category and have more fiber and are more complex, you're going to be able to control your swings much more easily. And also, it has a lot to do with the combining of foods and the timing of your foods. So, and we are going to get in depth with that in the root cause reset. But for now, I want to just have you do a little reflection, you know, look into your relationship with sugar and starches so that you can better understand the role of sugar in your health and your energy. So I'm going to, immediately after the call, actually promptly at 6 o'clock, you will get an email from me, and this is one of the things that will be included. It's a survey for you to take. It's not for you to turn in. It's not, it doesn't, you know, intend to suggest a diagnosis or that you have any problem. It's just, for you to look at and to start to think about how sugar really does affect you in ways that you probably don't even realize. On to public enemy number 2, dairy. So I know this is, I'll back up for a second with the slide. Dairy, a lot of people love dairy, and I'm with you. It's delicious. And at one point I thought it was, one of nature's perfect foods, and it really does on paper look that way. It's very balanced in proteins and fats. There are, unrefined, forms of it that, can be better than others, of course, than the more processed forms. But I feel I have to make the case for taking out dairy because it is such a well-loved food. And it's actually one of the reasons it's so loved is because it's a bit addictive. It has compounds called casomorphins, which are opioid-like in nature and dock onto your opioid receptors in the brain, much the same as something like heroin would, or maybe a drug like Valium or something. It makes you feel really good. So coming off dairy can be difficult for people because they're literally addicted to it. But I want to make the case as to why you might want to take dairy out of your diet and how it could be disrupting your digestion and health. So number 1, lactose. Between 60 and 75% of adults cannot properly digest it, and symptoms, can be mild to severe, and include cramping, bloating, abdominal pain, diarrhea, even vomiting after ingesting dairy products. The next is mucus. Milk contains a protein called BCM7, which is known to increase mucus production in both the respiratory and GI tract. And we know that excess mucus can worsen upper respiratory issues as well as decrease nutrient absorption in the gut, because it's this slimy coating that covers those intestinal cells and that brushed border, and blocks the absorption of nutrients into the gut, through the gut into the bloodstream. Number 3, insulin spikes. Now, even, if this is all we knew about dairy, we could still make the case to cut it out or at least reduce it. Milk is what we call insulinogenic, so it causes spikes in insulin. When you drink it, your pancreas, when you drink milk or consume dairy, your pancreas produces large amounts of insulin. And high amounts of insulin or high circulating levels of insulin promotes inflammation as well as hormonal imbalances. And of course, that's what we're really targeting with root cause reset is inflammation. So it makes sense to reduce insulin spikes and get insulin into an optimal range. And taking out dairy can help you to do that. Also, toxin pollutants. Dairy products have been proven to contain some of the highest concentrations of pollutants like flame retardants and dioxins. Research from both the Environmental Health Perspectives in 2010 and the Journal of Toxicology and Environmental Health in 2001 indicate that these toxins can damage the immune system, and long-term exposure can lead to reproductive and developmental problems. Also, chemicals and hormones. In 2010, researchers published findings in the Journal of Agriculture and Food Chemistry describing the discovery of over 20 pharmacologically active substances, including antibiotics, antifungal medications, anti-inflammatories, hormones like estrogen. We really don't want to be taking these in, and these can disrupt our hormones and drive inflammation for us. And the big thing is, though, if we're getting antibiotics and antifungals in through, our dairy products that we're consuming, at least 3 times a day as recommended by the USDA, then we can be killing off our good bacteria in our gut and damaging our microbiome, which is a major, root cause of digestive impairment and driver of inflammation. And so number 6, the last one, is disrupted digestion. Milk and dairy products contain protease inhibitors, which can create or worsen leaky gut. These inhibitors actually prevent your enzymes or proteases that break down proteins from digesting proteins, and then undigested proteins from dairy can then activate the immune system, because as I mentioned before, when undigested proteins get into the small intestine, and especially if there's a leaky gut, that can activate the immune system and drive inflammation systemically. So maybe this will help you to get to a point where you'd be willing to let go of dairy, at least for a little while, to see how well you do, and then reintroduce it to see what the effect is upon reintroduction. So gluten, public enemy number 3, and there's a lot of controversy around gluten. I know, especially a lot of my colleagues, dietitian, nutritionists, don't like taking out whole food groups, and and I understand where that comes from. But gluten is it can be particularly problematic, especially if you're having symptoms. You have a chronic, inflammatory disease state going on, or especially an autoimmune disease. The most damaging protein in gluten is called gliadin, and it can be found in wheat, rye, oats by contamination, and barley. And gliadin and really all gluten peptides are really difficult to break down. We don't have the enzymes to break them down. So we end up, getting these undigested fragments, protein fragments that can be tagged by the immune system and, activate the inflammatory process. So here's that picture, or that depiction that graphic that I was telling about earlier. This is a nice picture of the gut, the intestinal lining, and you can see these are the intestinal cells, and over here on the left, these look like healthy. These are what healthy cells, GI cells, would look like. And you can see in between here, the cells are connected by these tight junctions, and these tight junctions prevent molecules, above a certain size from going through. So ideally, we're only letting through, single amino acids and sugars, and we're not letting bacteria through and their waste products through. But what can happen with gluten, we get these indigestible fragments of gluten, and they cause these intestinal cells, or enterocytes, to produce zonulin, which is a protein that regulates the tight junctions and can cause them to open up and then let those undigested gluten fragments through, as well as other undigested proteins, bacteria, and bacterial wastes. So gluten can actually cause leaky gut. So you don't have to have celiac disease, which is an autoimmune disease where gluten, triggers, an inflammatory response in the gut, and basically flattens out all these microvilli here that are responsible for helping with nutrient absorption, or responsible for nutrient absorption. You don't have to have celiac disease to be affected negatively by gluten. Anytime you eat gluten, there is at least a temporary inflammatory response and increased intestinal permeability. But in someone who already has a leaky gut and already has a compromised digestive system, this can be very problematic and drive inflammation. And a lot of times, and this is what we would call gluten sensitivity. You don't even have digestive issues or symptoms. It's more you can have inflammation in the joints as well as the brain and neurological systems. And really, primarily in gluten sensitivity, that's where we largely see these symptoms, brain fog, fatigue, lack of focus and concentration. And I think now since we're talking about leaky gut and gluten, now is a good time to talk about the role that leaky gut plays in autoimmune development. Dr. Alessio Fasano, who is well known for his work in celiac disease research and treatment, and even the conventional GI specialists know who Dr. Fasano is, but interestingly, they don't tend to know about his work in his study of the GI, the gut lining, the mucosal barrier, and its function and leaky gut as a driver or the linchpin, really, in the development of autoimmunity. I found that out recently because I was invited by UNM's pediatric gastroenterology team to come in and do an in-service, and I proposed, I introduced this hypothesis to them, and they were very familiar with him, but had no idea about his work with autoimmunity and leaky gut, and how gluten can play a role in that as well. So his hypothesis, leaky gut as the third element in autoimmune pathogenesis. He has a great paper. I've referenced it for you here. He says, in addition to genetic predisposition and exposure to triggering non-self antigens, which could be, food antigens, could be virus, some kind of pathogen or a toxicant. The loss of protective function of the mucosal barriers that interact with the environment, mainly the GI tract and the lung mucosa, is necessary for autoimmunity to develop. So let me talk a little bit more about what that means. Okay, so this really, his hypothesis really promoted, the development of the concept of the three-legged stool of autoimmunity. So first of all, you have to have the genetics, and your genetics will, for autoimmunity, and your genetics will determine how autoimmunity is expressed for you, whether that's in your joints or in your gut or in your brain or in your nervous system, or your skin, like me. So genetic predisposition has to be there. Also have to have an environmental stressors and triggers. This could be infections and pathogens, toxicants, chemicals, as well as allergens and antigens from food or the environment. So there has to be a trigger, there has to be the genetics. But on the flip side, you can have both of these. You can have the genes, you can have the trigger. But if you don't have a compromised intestinal barrier function, if your gut is not leaky, if you have good gut health, then you're not going to develop an autoimmune disease. If you do have a leaky gut or a compromised intestinal barrier function, that's going to start with dysbiosis, which is an imbalance of the microbes in the gut, which protect the lining of the gut and, direct the life cycle of those cells, of the enterocytes. And it can start with also an insult to the microbiome, like antibiotics or radiation. And we all know that antibiotics are overprescribed these days. And, often even, when a woman is going in to have her baby in the hospital, she is given prophylactically a round of antibiotics. So it starts then and there, that her microbiome is damaged and compromised, and she, in the birthing process, passes that on to her child. And of course, the rate of C-sections is markedly increased over, the past decade or couple of decades. And that compromises the microbiome as well, because the child doesn't get that the mother's microbiome, passed on as the baby comes out through the birth canal. So the functional medicine nutrition approach to gut restoration, it doesn't matter what kind of illness or symptoms, set of symptoms we're dealing with. We're going to look at gut restoration because, like I said, it all starts in the gut. Inflammation starts in the gut. And autoimmunity is no different. And so we can reverse symptoms and disease, including autoimmunity, with gut restoration. And in functional medicine, we use the 5 R's, which are remove. So we remove infections and inflammatory triggers, so food antigens in particular through the elimination diet, clearing infections as well. We replace digestive secretions so that we're optimizing digestion. We repair the lining of the gut by bringing in gut healing nutrients. We re-inoculate the gut with good microbes through diet as well as probiotic supplementation and fermented foods, bubbly foods. And we're looking at also rebalancing our behaviors and life choices, our lifestyle and mindset. And this is really goes into healing your gut and reducing symptoms and reversing disease process. And I do want to tell you a little bit about a concept called the autoimmune spectrum that was put out by Dr. Amy Myers. She's a functional medicine physician and author of The Autoimmune Solution. Because we tend to think of autoimmunity as something that just spontaneously occurs with no warning, right? And that's because most of the time when we become aware of an autoimmune disease, it's full blown and we're in a flare and it's a crisis. But really there is a progression into autoimmunity, and it happens over months and years. And what Dr. Myers, her concept of this autoimmune spectrum is that, on one end, we have no symptoms, no inflammation, which, not many people are there these days. And on the other end, we have a diagnosis of an autoimmune disease. And in between, we have symptoms, inflammatory symptoms. We have increasing frequency and severity of symptoms. And the more symptoms we have and the more frequent they are and the more severe, the closer we are to, being diagnosed with an autoimmune disease. So, we're pretty much all on that spectrum. But the spectrum can kind of help us to identify where we are. And what I use to help dial that in is a medical symptoms questionnaire. And I'm actually going to be giving that to you today to fill out for yourself. It's a great tool for quantifying your symptoms, getting your symptoms going from out of your body, where you're experiencing them as normal and, it's just, you can't see the forest for the trees, and out onto paper and getting them, looking at them numerically. So it helps us both, you and I both, to understand what symptoms you're having, how severe are they, and what systems are needing support. And so it's a really great tool to use it to get a baseline of your symptoms, and we'll be doing that. I would encourage you after this call to fill out the MSQ for yourself, see where you are, and it'll also be a great tool for you as far as deciding whether or not you need to make some changes and whether root cause reset would be a good fit for you. If your score is over 50, I would highly recommend that you join us. And we will have you repeat the MSQ at week 3 and week 6. And you can certainly use it even after the program. Anytime you start a new protocol, you can use it to measure how effective that protocol was for you, and use it to inform where you'll go from there. So the objectives of root cause reset are to, we're going to remove inflammatory foods in a stepwise fashion. So, I have been known to just take somebody straight into the full-on elimination diet. And some people are up for that, but what I've learned is a lot of people are not, not quite ready for that. So I really wanted to, I want root cause reset to be inviting for a wider range of people, for people at different levels of readiness. So if you're someone who wants to, needs to ease in, this is going to be a great fit for you. We're going to start by removing those top 3 inflammatory foods. And Then, and at the same time though, we're also going to be working on stress management, self-care, blood sugar regulation, mindful eating, so that we're optimizing digestion. And we're going to spend a few weeks here before we move on to, you know, taking any more foods out, or, you know, going on even to the autoimmune protocol, which is a, you know, I would say the most effective elimination diet because it takes the most out, as far as the, you know, antigenic foods and gut irritating foods. But you may not get there, and that's okay. You may not need to get there. You know, taking out the top 3 inflammatory foods and just slowing down and doing more self-care and mindful eating, optimizing your digestion, that may be the ticket for you. That may be it. But some of you may need to take a little more out after a few weeks, and some of you, especially if you have an autoimmune disease, but you don't have to have an autoimmune disease to benefit from it, may need to go into the autoimmune protocol. And I will be giving you meal plans and recipes to support you no matter what route you choose to take or need to take. And I'm going to help you figure out, you know, or to determine what route you need to take as well. And we will be talking about proper reintroductions as well, because, you know, you don't want to waste all this time and energy doing an elimination diet not methodically reintroduce foods, you know, so that you know which foods are safe for you and which foods are causing inflammation for you and symptoms. We're going to look at, like I said, optimizing digestion via mindful eating, stress management, self-care, and blood sugar regulation. And I'm going to give you a lot of great self-assessment tools. I'm going to give you a food, mood, poop journal, actually giving that to you today, and so that you can start filling that out. And I would encourage you to get 5 days worth of journaling in before we start on October 17th. I'm going to give you a medical symptoms questionnaire tonight. In Root Cause Reset, I'm going to give you questionnaires to help you identify key nutrient deficiencies that could be causing inflammation and driving disease process for you. I'm going to give you a thyroid questionnaire because I find that so often thyroid issues are undetected, and a yeast questionnaire, as well as an anti-yeast diet and supplement protocol should you score high on that questionnaire. I'm going to be talking about functional lab tests that are available, as well as standard lab testing that you should ask your doctor to order for you. And I'm going to teach you how to interpret those through a functional medicine lens. Because, you know, so often, you know, your results come back as normal, but they're not necessarily optimal, and they do indicate core imbalances. So I'm going to teach you, you know, give you some functional nutrition, functional medicine know-how when it comes to that, so you can be the CEO of your personal healing journey and healthcare team. And I will offer you the option to take, to do the BioHealth 401H. It's a comprehensive stool analysis with parasitology, and also looks for the H. pylori antigen. And this will, plus a 60-minute consultation with me after those results come in. Because I do want to, you know, infections is one of those root causes, and I want to make sure that you have the ability to look for those, especially if you have a lot of digestive issues or a lot of inflammatory symptoms. There's almost, I mean, I have not yet run this test on a client. You know, someone who's working with me obviously has, you know, a lot of issues that they're trying to resolve. I haven't run a test yet on someone that hasn't come back with something, you know, H. pylori, parasite, overgrowth of, you know, certain bacteria. So I'm going to give you that option. Also, I'm going to give you the option to purchase discounted practitioner brand supplements through my online dispensary, FullScript, and an option to buy discounted Megaspore Biotic. That's my go-to probiotic. It's a spore-based probiotic that I use pretty much across the board these days because it's just so much more effective than your run-of-the-mill probiotics, even the, you know, the best live culture ones out there. I will be supplying holiday-friendly recipes as Thanksgiving gets closer. I definitely, because I know that we're running up against Thanksgiving. You know, during week 6 is the week of Thanksgiving, and I want to make sure that you are supported throughout the holidays. So I'm going to give you recipes that correspond with, the route that you've chosen to go, whether it's just gluten-free, dairy-free, sugar-free, or autoimmune protocol, or, taking some other foods out, but not going full autoimmune protocol. Whatever you decide to do, I'm going to give you some holiday-friendly recipes that not only your body will love, but your taste buds and your family's taste buds. And you'll have a private Facebook group. So you'll have not only professional support, but community and social support, which I think is huge, can be really huge to your success and adherence to, this process. And then optional ongoing group support. So after the program ends, I will be talking to you all about, the option to continue on with group support, whether that be once a month or twice a month. I plan to get a feel from participants as the time gets closer. So now it's time for Q&A. And even, you can ask me questions about anything that I talked about, some specifics of root cause reset, but also just the functional nutrition approach. I know I do have some practitioners and, nutritionists on the call as well. So I'm open to any questions that you all have. So you can just raise your hand or actually unmute yourself to ask a question. There's also the chat option as well. If you're shy, you can use the chat option. Just chat me a question and I'll keep you anonymous and I'll answer your question out loud so that everyone can benefit from it.
I have a question.
Yes, who's this?
This is Marla Wood.
Hi, Marla. Glad you were able to get on.
Last minute run. Thanks for the email. Otherwise, I would have missed it.
Sure.
I've worked with a lot of people from varying levels of medical practice to what I would call flat out woo crazy business practice, looking for answers. Are you familiar, or is there available a blood test that can signify your inflammatory reactions to particular foods? Are you familiar with anything like that?
I am, and I have to say that it's, they're not, none of the food sensitivity testing that I've seen, which food sensitivities are different than our traditional food allergies, right? And I think that's what you're talking about, are these delayed type food hypersensitivities that are really, underlying a lot of symptoms and inflammation, more so than the traditional types. It can be difficult to assess those through, available testing. They're not 100% reliable. There's the ALCAT test, there's the mediator release test, there's IgG testing, and there can be false negatives as well as false positives. What I tend to do is I start with a really thorough elimination diet, because either way, if you're going to do food sensitivity testing, you're going to end up on a form of an elimination diet. So I start with the elimination diet, and if we don't, if it still seems that we haven't maybe figured out all of the foods or all of the triggers, then I will sometimes bring in the food sensitivity testing just as a way to look to see what else might be at play here. But I tend to start with the good old-fashioned, elimination diet.
Mm-hmm.
Yeah. Does that help?
It does, yes. Well, one, to sort of help me judge another practitioner and whether he knows what he's talking about or not.
Okay.
But two, I have done a lot of elimination. Everything you talked about, I've been off of for 15 months. So,
okay.
And there's still issues. So I'm trying to figure out, what those low-level sensitivities might be, what is a cumulative reaction that may not respond or may not show a response immediately, but is building in my system or what. So that was the reason for my question.
Okay. Yeah. And, I would say, if you really want to look into that, maybe the mediator release test would be a good one. But just know that if you have a lot of positive reactions, that really indicates a leaky gut. If you're reacting to broccoli and spinach and then you've got a leaky gut. So what I tend to like to do either way is take out the main offenders: gluten, dairy, eggs, soy, corn, really grains in general. And may have missed one, eggs. I think maybe I missed eggs. That tends to help, calm the inflammation down enough to where we can start bringing in gut healing nutrients. But the other thing to think about is that if you've, been on a really strict elimination protocol for some time and you're not seeing results and you're still having symptoms, it's important to think about infections. Because if you are reacting to foods, you're not you're not in the first place properly digesting them, because you've got these undigested proteins that are making it down and into the gut and activating the immune system. So we have to go upstream of even the food sensitivities and think about optimizing your digestion. And what does that look like? That looks like slowing down, switching your nervous system when it's mealtime from fight or flight, from go, go, go to rest and digest. And it's about chewing your foods properly. And it may also be, a lot of times, it's about replacing your digestive secretions, that may not be, you're not making in optimal amounts, like your stomach acid, your pancreatic enzymes, bile. And if you have an infection that's driving inflammation, then you will not make your digestive secretions properly. And so it's hard to say what came first, the chicken or the egg. It's just this vicious cycle with multiple inputs.
Sure.
Yeah.
And for me personally, I've been on an antibiotic for about 14 months now.
Oh, wow. Okay.
It's a long, complicated story I won't bore everyone else with, but there's just a lot of balancing of the pieces of the puzzle. So I appreciate your approach for sure.
Oh, thank you. Yeah. Well, if you have any, questions, for me personally, feel free to email me.
Okay.
Talk about it. Sure. Thank you for that. Anybody else? Remember, you can use the chat if you're shy. I know it was a lot of information, so you're probably just trying to digest, absorb, and assimilate it all. No pun intended. Actually, pun intended. I meant to do that. Okay. So, well, you will be getting, actually already in your inbox, because at 6 o'clock I scheduled that email to just come out so I could give you your food, mood, poop journal, your medical symptoms questionnaire, and your sweet tooth reflection survey, so that you can, up front, start looking at your patterns and your symptoms, and, start to see where you, might have, there might be opportunities where the functional nutrition approach can help you, and where you might need to make changes. I really appreciate you all making time, carving out, your evening to join me tonight and to hear about the functional approach and root cause reset. If you have friends and family members who, like most people, are struggling with, really wanting to reverse disease through a natural approach, but just not getting that from their doctor, or from your doctor, because that's not what your doctor's trained to do. Your doctor's trained to prescribe and to recommend surgical interventions. So when you come to your doctor wanting alternative options, you get dismissed, and it's not personal. And it's not, that your doctor's trying to be mean. It's just they don't really know what to tell you and what to do. So functional medicine and functional nutrition is that approach that you've been looking for if you've been wanting to take your health into your own hands and to heal yourself naturally. And so, I'd encourage you to join us inside Root Cause Reset. Registration is now open. You've got the email in your inbox with the registration link. And I didn't mention the price of the program. So it is a 6-week program, lots packed with tools and insight that has taken me years to and lots of money to figure out and to get trained in. So the cost of the program, very cost effective, is $147, and that's the early bird pricing. If you get in before next Monday at midnight, then you will have that price. After that, the price goes up to $197. So I'd encourage you to get in, very soon. And actually, if you register today, tonight before midnight, then you will receive a free 30-minute one-on-one private consultation with me to discuss your issues more in depth and in a more individualized way. So I hope to see you inside. Thank you so much for joining me tonight, and please reach out if you have any questions. And were there any more questions before we close? Still happy to take those. Aha, there's a chat. I knew it. Okay, so this person says, privately, are you familiar with the research about vitamin D deficiencies and HCM? HCM, not sure. For some reason, I'm not. What's that acronym? I've seen multiple physicians who have recommended surgical treatment, medication, which I'm not interested in, seeing our local chiropractor who has me on nutritional supplements. Okay, so I'm sorry, yeah, vitamin D and HCM. If you can let me know what HCM, because there are so many acronyms, and that one's just not, for some reason, ringing a bell. Hypertrophic cardiomyopathy. Well, I mean, that's not something that I have, had the opportunity to, work with a person who has this. So I haven't looked into it a whole lot. But I do know that vitamin D deficiencies, vitamin D is a rate limiting factor in almost every metabolic process. So, I would be, I'd be happy to look into that for you. Let's see. I don't see who wrote that to me. So if you want to just email me, Angie@enlightenedwellnessfx.com, we can look into it a little bit more. I definitely don't claim to have all the answers up front, but I do have the tools to really look in and investigate. And that's what functional medicine and functional nutrition is all about. It's not about being being a practitioner of that. It's not about being the all-knowing practitioner. It's about knowing how the body works and, knowing how to give it what it needs and take out the things that are bogging the systems down. So I'm sure that there is, an answer that we can tease out through functional medicine, functional nutrition. So if you want, email me privately and we can look into that further together. Okay. Anything else? Okay, well, it's time to go because my 3-year-old has come in. I forgot to lock the door. So, yeah, thanks again, everybody. Have a wonderful night, and hope to hear from you and see you inside Root Cause Reset. Good night.